Mental professionals of Reddit, what is the worst mental condition that you know of? That's a hard one to answer because everybody is so different, and their experiences of mental illness can be so different. For instance, I've worked with people with chronic schizophrenia with hallucinations so horrendous you can barely imagine, and others who manage the same chronic mental illness with totally different symptoms and a high quality of life. I can definitely think of individuals with particular presentations of mental illnesses I would consider to be the worst I've ever seen, but thankfully not everyone with those illnesses will have that same experience. More adjacent to the field, but one person who compulsively ate glass. They'd break light bulbs and windows just to have something sharp in their mouth. They'd be at the ER every month. One person who ate dirt. They would pack so much dirt into their mouth until they could not breathe. One person who was in the system since adolescence. They would compulsively have sex with whoever. At 18, they started sneaking out their window, undressing outside of the facility, and offering themselves to homeless men. Yeah, I look at the world differently now. Psychologist BSc. Nurse 7 years experience. Psychosis, the acute phase of schizophrenia. You are capable like a healthy human being, but lost your marbles. That is a very dangerous situation, responsible for lots of violent crime on this planet. Edit. I judge someone losing his or her mind out of anger as psychotic as well. I see it on a spectrum where the full psychosis is more stable, lasting for a while. That's what I meant when I said responsible for lots of crime. Have a friend who works with seriously disturbed patients, and told me about a woman that habitually drank hand sanitizer. Apparently when you do that, your joints lock up and you have to be immediately rushed to the ER for treatment. And what do they have in the ER, every 10 feet or so? Yeah. More hand sanitizer. So this woman would have to be restrained, otherwise they would find her in the hallway pumping it directly into her mouth all over again. Borderline personality disorder still terrifies me. It's okay, it's the one in my job that I have to help manage patients with, and for me, it's one that troubles me the most because it's what I find personally the hardest. Also, there's been some events with BPD patients that have genuinely scared me. So, that's my answer to the question in the title of this post. There are no specific pharmaceutical interventions for BPD itself, but pharmaceuticals can help with accompanying issues, and BPD actually does respond quite well to psychotherapy, which is a medical intervention. The difficulty lies in getting someone with BPD to go to therapy and stick with it. Delusional parasitosis comes to mind with this prompt. I've watched a patient go to well over a dozen doctors trying to get confirmation that they're parasite-ridden. After countless stool samples, blood work, labs, scans, biopsies, etc., she clearly didn't have any but remains convinced. I work in the field but not as a clinician yet. I find NPD really hard to deal with. You get these charming PPL with absolute destruction in their wake. I work in a ward where you get forced to go and legally can't leave, so we see the extremes of each condition. Not nearly the worst. Pica eating things that aren't food is probably the worst I've seen. But dissociative fugue really blows my mind. I've always wondered how many missing person cases are just a result of DF. I mean worse is schizophrenia because it's a combination of many different mental illnesses. But for me it must be bipolar because I have some family members with bipolar. As someone who has experienced it twice, I have to say the worst is a drug-induced neuropsychiatric movement disorder called akathisia. The terror is unlike anything. The one that's left unattended. Get in there and poke around sometimes. Dust out the cobwebs. A clean mind is a healthy mind. Anyone can be at risk of deterioration. I heard about a guy who thought he was on fire all the time he was awake. So he screamed until he passed out. Day after day. How can you even treat that? I'm not a professional, but after seeing the damage dementia can do, I can't imagine anything else would hold a candle to that. Rest easy, Grandma. Hard, Reddit addiction. It's like slower rabies. Seeing the brain deteriorating so quickly in people without any other condition, no pathogen or anything. I'm not a professional, but I have an immediate family member who is a diagnosed schizophrenic and borderline personality. It's one hell of a combo. Body integrity disorder, believing a part of your body isn't yours and needs to be removed. I knew a patient that removed her eye. Catarrh syndrome. Now here's the beauty. Mind you, it is not a contest. Most of them are very undesirable. There has been a lot of discussion between BD and BPD. What's the main difference? Which is worse? To me, well adjusted to modern society. To be what social norms encourage as normal. I have a friend with schizophrenia and it's hell for her.